HRT isn't just for men. This is why postmenopausal women need to heavily consider it. Ladies, you know better than anyone how tough menopause symptoms can be. Your hormones are rapidly changing and degrading. Whether it's intense, warm episodes to mood swings, these negative symptoms don't have to be as bad as they are. HRT isn't just for men. It's an extremely effective treatment for women going through menopause too. Stick around to the end for a bonus solution to the sexual discomfort you're experiencing after menopause. Hi, I'm Dr. Alex Spinoso, MD, CEO, and founder of Genesis Lifestyle Medicine, where we help you reverse aging and stay young as long as humanly possible. If you're new here, make sure to click that subscribe button and like the video. Check out all the links mentioned in this video in the description below. Today, we're going to be answering all of the questions you've ever had about HRT for women. I'll be talking about how it works, what it does inside of your body, how to know if you're a good candidate, what the treatment options are, what it looks like, what the results are, how much it costs, and what the side effects are. So there are multiple ways that HRT for women work. The main hormones that we always look at for women are your estrogen or estradiol, your progesterone, and really important, and most important in some cases, is your testosterone levels. These three major hormones are the hormones that we always look to attack and correct first. Now, how do we correct them? We do it one of three different ways. Number one could be weekly injections. Usually that's very simple with testosterone therapy. However, estrogen therapies and progesterone therapies usually don't have these weekly injections that help as well to balance your hormones. The second way we do it is through pills. Estrogen and progesterone can be taken through pills. Testosterone to a lesser degree can as well. And the third way we do it is called pellet therapy. Now, pellet therapy is what looks like grains of rice that are inserted under the skin and give your body the amount of hormones that it specifically needs over a time period of 3 to 4 months. These three ways help balance the hormones in a female. HRT changes one of three hormones, either your testosterone levels, your estrogen levels, or your progesterone levels. Each one of those has a myriad of side effects on the body, such as reducing postmenopausal hair loss, feeling cold all the time, issues with metabolism, etc. We balance those out to bring your body back to physiologically normal when you were in their 20s and 30s. The only way to know if you're a good HRT candidate is getting your labs done at a clinic who specializes in HRT or hormone balance. Many times you might go to your primary care doctor and they might tell you, we checked your hormones. Now, the only hormone that they're likely checking is your thyroid hormone. While that's a very important hormone, it's not one of the hormones mentioned because usually the thyroid is already taken care of by the time you go to a hormone specialist clinic such as Genesis. However, going to a hormone specialist clinic and getting your blood work actually done, checking for the testosterone, estrogen, and progesterone, as well as your thyroid, is vital to make sure that everything is balanced, or if it's unbalanced, to give you insight as to how to correct it. Now, how do you know you have a lab imbalance? Usually the symptoms will tell you. Do you have trouble losing weight? Do you have trouble with anxiety or with sleeping? Do you have issues with your hair falling out or being brittle? Do you have skin issues where you have dry skin? Do you have skin issues where you have super oily skin? Do you get a lot of acne? Do you have issues with bloating? All those different things can be signs of hormone imbalances. HRT gives you your life back. I know, because that's why I started in this field. I felt sluggish, no energy, had a bunch of brain fog, and realized that my hormones were ridiculously imbalanced. Once I got them balanced again, I was able to sleep better, I was able to do work better, my brain was extremely clear afterwards. So if you're feeling foggy, you have issues with thinking during the day, you have issues with sleeping, you have issues with your libido, you have issues with energy during the day, get your hormones checked, and once they're balanced, you're going to feel like a completely new person. HRT costs vary widely depending on where you go and what treatment you get. Talk with your provider about what the best option is for you. Really, the cost doesn't matter if you feel like $1,000,000. Now, costs can range between $50 to $400 $100 a month. It just depends on what treatment you're getting. So make sure that you're discussing with your specialist what the best treatments are for you and your hormones, and just go in that direction. Some of the main side effects of hormone therapy are issues with libido being too high. Sometimes you can have a little bit of anger issues at the beginning until your hormones balance out. Bleeding or spotting is very normal as well, especially obviously in females. If we're trying to get your hormones back to where they were in their 20s and 30s, it may restart your cycle or start a small cycle during the treatment. Many of these side effects usually go away if you keep your hormones physiologically normal and don't overdo the hormones. That's why it's very important to always go to a specialist. Now, one of the major issues postmenopausal females come up against is issues with painful intercourse or issues with incontinence, urinary incontinence. You cough, you sneeze, you laugh, and you end up accidentally peeing yourself. We have multiple treatments to help tighten up those muscles down there, as well as increase orgasm significantly. One of the treatments is called the O shot, or the orgasm shot. We use PRP, platelet-rich plasma, inject it into the area to help revitalize and replenish the blood supply and the nerve supply down there. We also have a treatment called FemiWave, which is a acoustic shockwave therapy that helps break up blood vessels and strengthen the pelvic muscles. The last treatment we have is called the Emsella chair. This is a magnetic wave chair that helps flex the pelvic floor muscles 10,000 times within a few minutes, creating strength and increased blood flow to the area. All these treatments combined or individually significantly improve urinary incontinence, significantly improve intercourse satisfaction, as well as orgasms. I hope all of your questions about HRT have been answered. If you're a woman struggling with menopause symptoms, then we would love to help you. Our medical clinics have 19 locations around the country and are growing every day. We've helped thousands of women with HRT and with urinary incontinence and sexual dysfunction with our O-Shot and FemiWave and Emsella chairs. Click the link in the description to book a consultation with one of our experts. Don't forget to like and subscribe, and we'll see you next time.